This episode of Fertile Talks is sponsored by ilmeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ilmeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello. This is Dr. Famuyiwa and Dr. Erica Bove.
Hi.
All right, we're doing it again. We are at the American Society of Reproductive Medicine conference that's going on in San Antonio.
Yes, we are actually on the river walk right now. So you can
Yes.
maybe hear, see some of the delights behind us. We have
Yes.
trees and
Yes.
birds and a river. And
Yes.
so we are right behind the convention center while we are airing this.
So what we want to talk about is some of the things that we learned during the conference. So we can talk about what we learned, right?
Yes, sure.
So one of the things that I learned was the breast cancer survivors. So they talked about the fact that breast cancer patients have to have counseling at the time of diagnosis, right? It's imperative because if people who are young, who are getting more and more cancer, fertility is paramount for them. So they may say that I'd rather die than not have a child. So we need to be cognizant of that these people are suffering from breast cancer, but also they want to have children. So that's one of the things they raised in the conference.
That's fascinating. Well, one thing I learned about is the concept of uterine transplantation, and I had no idea that over 50 babies have been born.
Isn't that weird? Yes.
Over 130 uterine transplants to date in the U.S.
Yes.
And over 50 babies have been born, and I just found that really fascinating because I knew it was happening, but I didn't realize at quite what level. And
yes.
the safety and effectiveness, we talked about it. There's no intervention that is completely without risks. Although I was really surprised that the data looked as encouraging as they did.
Yeah, I was surprised too, because I must admit I was a little biased that, I really, because I just had a patient who had endometrial cancer, and so the oncologist says, well, we need to do a hysterectomy immediately.
Wow.
So I had to freeze her eggs after the hysterectomy, so her uterus is gone.
Wow.
So that's really these patients really want that. So it's really interesting that they have to deal with that.
Yeah, absolutely. What else did you learn?
What I learned is, I think Dr. Parry is his name. He is an expert in hysteroscopy. He would use neurosurgical hysteroscopes to get into the uterus through the vagina without dilation.
Really?
And he could come up with neat diagnosis. He could diagnose endometriosis, micropolyps, without dilating the cervix at all.
Wow.
And he did that with everyone trying to go for IVF and was able to pick up so much pathology.
Wow.
Especially in patients who've had recurrent implantation failures, recurrent pregnancy losses. He went in there and saw severe endometriosis.
Wow.
That it shows up as tiny polyps,
right,
and a strawberry hemorrhagic pattern.
Sure.
And some of them, he says, you know what? I'm just going to treat them with doxycycline flagyl. Incredible success.
Wow.
So that made me want to say, I need to go get one of these. It's a hysteroscope that the neurosurgeons use to go through the nose to get all the way to the pituitary.
Wow.
It's extra fine and thin and can be adapted to the uterus. So you don't have to dilate. You don't have to go to the operating room. Now, mind you, it's mostly for diagnostic purposes, not operative. Yeah.
But I would say, you know, because we are already doing diagnostic procedures like the saline infusion sonogram, that gives us a three-dimensional rendering, but we can't see the tissue with our own eyes.
Exactly.
In this way, this could be potentially superior.
And it's a good thing that you mentioned that.
Yeah.
He does both at the same time. So he says they come in the office, he gets this tiny hysteroscope in, he does the saline sono, he does do HSGs because he likes the information on the tube.
Yep.
And he's able to just triage the patient, boom, ready for treatment. So
isn't that interesting? After all these years, you know, you can learn something new about the anatomical evaluation.
Exactly. So what else did you go to?
I went to a session today on what's called in vitro maturation of eggs, which was fascinating to learn about how people are doing egg retrievals without even using FSH or any medications to stimulate the ovary and getting 15 eggs in an IVF cycle. And so without any medication, doing an egg retrieval, taking those immature eggs, and then in the laboratory being very precise, and then turning those immature eggs into mature eggs. I thought it was very interesting.
I think that probably will have an application in PCO patients.
Absolutely.
We have a ton of antral follicles.
Absolutely.
And they're at risk for hyperstimulation.
Absolutely. And also prepubertal cancer patients too.
Oh, yes, absolutely.
Yeah.
We can do that. Interesting.
What else did you learn?
So today I attended a roundtable where we discussed it's very controversial, ovarian rejuvenation. That was the big thing. And I had two experts, one from China, and her medical director used to be my lab supervisor at NIH. They now run a center in China. They've done over 1,000 of the PRP in the cavity.
Really?
So I'm like, I didn't really have much success with it. What are you doing? So they said, well, they have this technique where they use a hysteroscope and they inject 4 spots in the endometrial cavity in the basalis layer.
Wow.
And they were doing it for people with very recalcitrant, thin, one of those stubborn, lining.
Yeah.
And getting success with it. They were also using it in premature ovarian insufficiency patients, which when you get those, you tell them you need to go get them. So they were able to get a few of those patients to recover.
Wow.
And their thing was, it actually takes, if you think about it, the antral follicle develops over several months, not days.
Right.
So when you do it, they said you really, in those patients, need to wait up to 3 months to see a benefit. Like, interesting. And they were using the regular pickup needles, which I thought you had to have I was using a skinny Kitazato 22, 21 days.
No, an egg retrieval needle.
They bug hole when you try to do therapy with them. So it's something that they're doing studies on. I want to see their data, but they've done thousands. So that was interesting.
That's so fascinating. I think the PRP stuff is the next wave, really. When I look at the preliminary data, I get very excited about it.
Yeah, and also they talked about now this is not approved for human use, even in China, is the stem cells. They're doing stem cells. They're getting placental stem cells, and they're using stem cells in both the lining and in the ovary, although in a very tightly regulated experimental conditions.
Wow.
So I can't wait to see what the data will be. And they're using exosomes.
Wow.
So that may actually turn out to be more useful than even stem cells.
That's so fascinating.
Which may be more useful than the PRP.
Wow.
Now, I do caution, the reason I would entertain a PRP in a patient would be someone who's, say, 39 years old, 35-year-old premature ovarian insufficiency.
Yeah.
I do have some patients who are Muslim, and they tell me culturally they can't do donor. Religiously, they can't.
Yeah.
So if they want to try it before they abandon all hope, then, you could see an argument for that case.
Absolutely.
So I think the data is still out. And also, let's note that the way PRP is prepared matters.
Yeah.
So some of the initial PRP studies, they use a single spin. So they were not really concentrating the platelet
Got it.
as high as they could.
Interesting.
Yeah.
Wow.
Yeah.
It's so exciting to be here and just to be hearing all that, all the innovation and
yes.
how directly applicable to patients this is.
And that's the key
Yeah.
thing.
Yep.
What else did you learn?
Goodness, I actually went to a talk today on provider burnout, which is something that, you know, we think about having long sustainable
Yes.
careers. I think about you
Yes.
being a solo practitioner and
Yes.
taking care of all these patients, and you know, it was really about how do we continue to fill our own well, how do we
Yes.
recognize stress within ourselves,
Yes.
and how do we keep that balance of continuing to serve other people
Mhm.
and, you know, recognizing our own signs when we need to give ourselves a little bit more to fill our
Yes.
tank. So that was just interesting because I think people don't talk much about it. Sometimes it can be a very sad job that we have.
Yes, I think so.
Yeah.
And I think one of the things that has helped me over the years is I always tell my patient, I love what I do.
Yeah,
I
it's true.
enjoy it. Be friends that you make along the way.
Yes, I know.
So, you know, just, you need that friend that, you know, just when you're in the doldrums, someone
Yep.
to pick you up.
Yes.
And you go, oh, wow, I can do this again.
Yes.
And then sharing our stories with each other,
Yes.
supporting each other, I think has been wonderful.
Yeah.
And family, no matter
Yeah.
what that family looks like,
Yes.
right? Just that social support.
Totally. And, you know, as you mentioned the stories, I just like to put in a plug for your book that's coming out. Because you're going to be on my podcast. We're going to hear some of those stories, but you're actually in a very legacy driven way.
Yes.
You are actually capturing the stories of many of these women, and your book is out for publication.
It
So
is.
share more about that, please, because I think the people want to know.
Thank you so much. My book is called The Quest for Fertility.
Yeah.
And I'm actually taking votes on what the cover will be.
Yeah.
I am telling science from the point of view of patients. I hope patients can see their stories in some of the stories I'm sharing. And I'm using these stories to teach the science and show what works, what may work, and give hope to people. So mine is story based, but leading into the science, if you will.
Yeah.
So and I do take that to heart. And I really think you're going to learn some of these stories are incredible because some of them actually surprised me in the outcome. And I want to share that with you. I want to teach you some of the things we're learning too, the latest, the breaking, and make fertility less stigmatized, less scary, less stressful, which goes into your turf, right? To reduce the stress.
Yes.
So people can get pregnant.
Yes.
So,
yes.
yeah.
And that's it. So, I mean, I think those are pretty much the highlights of what I learned and what I'm going to take back with me. Of course, there's going to be more sessions tomorrow, so I can't wait for those as well.
Yes.
Is there anything else you want to say for
I
our audience
want to thank everybody for indulging us. And this has been a labor of love. I hope we keep doing this forever and a day.
Yeah, I know this is our second annual conference review, and so we'll keep sharing what we learned.
And look at the river walk.
I know it's stunning in the sun setting, and you know we love you.
Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.